Hello everyone, I'm Neil, Managing Director here at Caremark Glasgow West.
And I'm Emma, I'm your registered manager, and today we're talking about something that affects so many older adults: anxiety and low mood.
Now these are topics families often struggle with. They're emotional, they're complex, and they can be hard to spot.
They can be. So our hope today is to help you understand what signs you can look for and how you can support someone that you care about.
So Emma, when families call us, they often say something along the lines of, Mum just isn't herself. What does anxiety actually look like in older adults?
Well, some signs can be subtle. Things like withdrawing from activities, worrying more than usual, restlessness or pacing, changes in sleep, becoming easily overwhelmed or feeling unsafe, doing things that they used to manage.
And sometimes families think it's just natural aging.
They do. But anxiety is not just getting older. It is a real emotional experience and it does deserve support.
And crucially, our team is trained to recognise these signs.
They definitely are. And through our Academy of Excellence, our carers learn how to spot emotional changes, not just the physical ones.
And what about low mood? How is that different?
Low mood can look like loss of interest in hobbies, decreased appetite, sleeping more, feeling flat or disconnected, or saying things like, what's the point?
And again, families often incorrectly blame themselves.
They do. But low mood is common, especially after bereavement, illnesses or big life changes. It's not anyone's fault.
So let's talk about what families can actually do.
Well, the most important thing is to be gentle, be connected, small conversations, encouraging routine, offering reassurance without pressure.
And not trying to fix everything.
Exactly. Just being present can make a huge difference. And if someone's living with dementia, we use approaches that reduce anxiety and create calm, something our team is specially trained in.
That's a big part of our dementia specialism.
It is. Understanding how emotions show up differently and how to respond with patience and compassion.
And Emma, when should families reach out for professional support?
If someone's anxiety or low mood is affecting their daily life, their safety or their well-being, it might be time to speak to a GP. And if there are sudden changes or talk of hopelessness, then that's urgent.
Understood. And families don't have to navigate that alone.
No. We can help guide these conversations and support the person throughout the process.
This is where Caremark Glasgow West can make a real difference.
You're right. And all our carers provide emotional support, routine, reassurance and companionship. Sometimes just having someone visit regularly can transform how a person's feeling.
And because of our Academy of Excellence, our team is trained to notice emotional changes early.
They are, and we don't just support tasks, we support the whole person, their confidence and their dignity, their sense of self.
And that's why we're building a service that aims to be the gold standard in Glasgow.
You're right. Care that's consistent, compassionate and genuinely life enhancing.
So that's a look at anxiety and low mood in older adults, what it can look like and how you can support someone you care about.
At Caremark Glasgow West, we're committed to delivering care that supports emotional well-being and not just physical needs. Through our Academy of Excellence, our dementia-aware approach and our ambition to the gold standard in the city.
If you'd like to talk through your situation or even just ask a question, we're always here to help.
You're not alone, we're here to help.
Thank you very much for watching.
And take care.
Yes!